My name is Michelle Sims. I'm a family nurse practitioner, and I'm a regional director for nurse practitioners at VCH and the associate head of the Department of Nurse Practitioners at VCH. I've been working at VCH for 17 years. My career journey with VCH started when I was a student nurse, and I was officially hired to VCH in 2006, where I started at the South Health Community Health Center. I was a public health nurse. I worked across VCH youth clinics and primary care in Vancouver community. In 2010 until 2012, I started my nurse practitioner degree and worked at VCH during that time. In 2012, I finished as a nurse practitioner at the University of British Columbia and started working in the downtown east side. And then in 2017, I moved over to the North Shore to primary care again at a clinic called Health Connection, which is owned and operated by VCH. And I still work there. I have a family practice as a nurse practitioner. Alternatively, and at the same time, in 2019, I moved into leadership and became a nurse practitioner lead under professional practice. And then moved to my current role as a nurse practitioner director and the associate head between 2020 and 2022. I have had so many career defining moments at VCH, and it's really hard to really pick one. My career has been varied and it's been diverse, and I think what's been the most meaningful is following my patients as a clinician and a provider across their journeys. And I think back to my time in the downtown east side and how it really impacted my practice. And I think it's really helped me to identify what my principles are and my values in the care that I provide for my patients. I carry a social justice and equity lens, and I know it's from that time working in that area. I really feel like VCH has supported my career journey. I think back to my early days as an RN and just the support I had from colleagues and mentors who were nurses in public health and across the system. And I had incredible support from leadership and clinical coordinators and managers who supported me as I grew in that role. And when I went back to school to do my nurse practitioner degree, I had tremendous support from my manager at the time, who really championed that leap because it was a big thing to do in my life at the time, and really supported me going back to school and maintaining some work while I was in school. And she actually wrote one of my referee letters to get into my program for my NP program. And so I really felt that there's been a lot of support for me through the years in my journey. I think advice for people who are building their career at VCH is to be curious, to seek opportunities, to ask for help and guidance when feeling stuck, because it inevitably does happen. Find your mentors and ask for feedback. Be innovative and come to your leaders with solutions. There are so many incredible options for folks for their careers, and I think that careers are very long. So have fun with it and lean into your organization to help support that journey.